Hello, my name is Cody. I'm going to be your student nurse today. I'm just here to perform a head-to-toe assessment on you. Do you have any questions before we get started? It should only take about 10 to 15 minutes.
No, I don't.
Okay, so then I would come in, do hand hygiene, close a curtain or a door to provide privacy, and then I would adjust my bed to working height. And then can you please confirm your name and date of birth for me?
April Stout, April 1st, 1980.
Okay. Now I'm just going to ask a couple of health history questions. So are you allergic to anything?
Salsa drugs?
Okay. Do you have a history of alcohol or smoking?
No.
And then have you had any recent surgeries or procedures that we should know about?
No.
Okay, now I'm going to start with a visual inspection. So I would do a visual inspection of the general skin color. So the skin color appears appropriate for ethnicity. The patient is just on room air. They're not on any supplemental oxygen. And then the patient is having unlabored breathing. Now we're gonna do the vital signs. So could you please tell me on a scale from 0 to 10, 0 being no pain at all, and then 10 being the worst pain that you can possibly imagine, what are you at on that pain scale today?
0.
Okay, now we're going to check the temperature. So I have an oral thermometer here. Turn that on. Okay, under the tongue. And our expected finding is going to be 98.6. That is like the average finding for temperature. I don't think that it's working.
Is it on?
Yeah, but it's like acting weird. Okay, there, try it now. Okay, it's working. It's still going. Okay, 98.1. Okay, now we're going to check, I'm going to check your pulse. So if I could see your hand. Okay, so your pulse was 80, and then I also counted the respirations for the next 30 seconds, and your respirations were 14. So for our pulse, our averages are going to be between 55 and 90, and then for respirations, anywhere from 12 to 20 is in our expected range. For our O2 saturation, I would use a pulse oximeter and put it on the patient's finger, and then that would go ahead and record the pulse ox for me. I don't have one today, but our expected findings for that are going to be between 95 and 99% for the O2 saturation. I could also look at the lips for signs of like cyanosis, and that could be another indication that maybe a patient's oxygen isn't where we want it to be. Okay, now we're going to check the blood pressure. So I want to make sure that my patient's legs are uncrossed, that they're relaxed. Okay. All the way to the right, and our expected findings for this are about 120/80. All right, just relax your arm right there. All right. All right, 112/76. Take that off. All right. Then we would go ahead and assess the patient's head shape. So the shape appears rounded, symmetrical, and no visible masses. Then we would look at the patient's ears to look for any drainage, any redness that could indicate like a cold or something. Look at the ears for any redness. And then we would look at the lips, look for the color, any signs of cyanosis again. This patient's lips look appropriate for ethnicity. Now we're going to look at the arms. So again, skin color appropriate for ethnicity. We're going to feel bilaterally for their temperature, and a temperature appears warm, and then they are also dry. Now we're going to look at the skin turgor. So if you'll turn your head over, we're going to go like this. Come a little closer. Go like this. And the skin turgor is elastic and there's no tinting. Now we're going to look at the capillary refills. So, all right, color returns in less than 3 seconds. Then on this hand as well, color returns in less than 3 seconds. Then we were going to check any of the bony prominences like the elbows, the wrists, to look for any skin breakdown. And then we're going to do kind of the same thing for the legs. So we're going to check their temperature, so warm, and moisture is dry. Then again, we are going to look at the capillary refills. And the color returns in less than 3 seconds here as well. We could also look for any swelling. On the ankles is going to be a big place. Check for any like edema as well, which there are no signs of here. And then again, we could check the bony prominences like the knee, the ankles, and then especially the heels for any skin breakdown there as well. Okay, now we are going to listen to the lungs. Well, first we're going to do symmetric expansion. So go ahead and breathe out for me. just turn this way a little bit. We're gonna do it on the posterior side as well, so breathe out. Okay, breathe in and out. Okay. All right, so now we are gonna listen to our breath sounds, both anteriorly and posteriorly. We're gonna start with anteriorly. Okay, come right there, okay. And breathe in, out, in, and out, in, out, in, out, in, in, out, in, out, in, out, and in, out, and in, and out. All right, so the lungs were clear in all 5 lobes and no adventitious sounds were heard. Now we're gonna do the same thing on the posterior side. Okay, turn just a little bit more. All right, so breathe in, out, in, and out, 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 out, in, out, in, and out, in, and out, in, and out, and then one more, in, and out, and in, and out. Okay, so again, lungs are clear in all 9 of my places, and no adventitious lung sounds were heard as well. Okay, now if you'll go ahead and lay back for me, we're going to do the abdomen assessment. So first we would note the contour of the abdomen. So we get down and look, and the contour of the abdomen is flat, which is our expected finding. Now we're going to listen to our abdomen. So go ahead and put this on. We're gonna start in the lower right quadrant and listen for our bowel sounds. Okay, and then normoactive bowel sounds were heard in all 4 of our quadrants. Now I'm going to palpate the abdomen using light palpation. So, any pain?
Mm-mm.
Any pain? Any pain?
No.
Any pain? All right. So soft palpation and there was no pain. Now if you'll go ahead and sit up for me and turn this way, we would check the back. We would lift the patient's shirt and check like the shoulders, the back, the hips for any skin breakdown there as well. We would also at this time check any of the lines, the tubes, anything like that coming out of the patient. This patient doesn't have any, but that's something we want to know. Then, okay, you can go ahead and straighten out this way. So then we would go ahead and lower the bed, make sure that our wheels were locked, make sure the patient's call light was within reach, raise the side rails, make sure they had their non-skid socks on, ask if, do you have any more questions for me today? Anything else I can help you with?
Nope.
All right, perform hand hygiene, and then exit the patient's room.